Okay, first and foremost, congratulations on finding out the baby is a boy. Yay! So this means we're gonna fix all our upcoming videos to prepare you for boy stuff instead of girl stuff. No offense, Audrey May, but yeah, different. I talked about it with a few people, and we decided instead of doing diapering with the real thing, because of nudity and stuff, we are going to find a stand-in. So we will have to find something that looks similar to a Twig and Berries and start getting you ready for the real deal. Some things that we did that you should probably think about. The PPTPs. Don't waste your money. That kid is going to pee everywhere, on everything, on you, in your mouth, on everything. We'll show you how we set up our diaper wedge thing with all the waterproof stuff underneath and layers and layers and layers. So you can just throw it in the sheet and then reset everything. What else? Oh my gosh. I remember when we had him circumcised and brought home, I had all these questions because I didn't know anything about the penis. I mean, no offense, I don't have one. So it was a little difficult to know what was normal versus what was abnormal, versus coloring and swelling, and if things weren't healing right. One of the big decisions is going to be, are you going to have him circumcised? And I would certainly ask you to consider not having him circumcised, but that is a decision you guys are going to have to make on your own. And of course discuss hospital policy on painkillers, what's given to the baby, how it's taken care of, is it done by a plastic surgeon, is it done by a regular doctor. These are all important things to know and ask. The other thing is you don't have to get it done right away if you decide to go see a specialist to get it done. What people don't tell you is sometimes they are done not right because parts are so tiny that you may snip a second hole in the penis or the skin. I mean, there's just a lot of stuff that can go wrong on a very tiny penis. So, you know, if that's something you're passionate about, you can also consider holding off until the kid is old enough to have pain meds. Because they have, you know, figured out now that obviously tiny people feel pain. Obviously, duh. I know. Exciting. So stock up on lots of Lysol spray and Lysol wipes for things that he's going to pee on. What else? Oh my gosh. Oh, the one thing I really want to mention is when you Google stuff, because you're going to figure out something that you have to Google, whether it's a rash or a fever or like other symptoms. Find a secure, safe parenting site to resource so that you don't just Google swollen penis or like whatever you think the medical term may be. You're going to learn a lot of medical terms, and you should be able to identify all the parts of your tiny person's Winky. And you're going to have to pick a nickname for it. We use Winky. And how you Google that so that you don't end up on some weird accidental porn site, which totally happened to me. Not cool at all. So, you know, always do parenting, comma, swollen whatever, or question regarding, you know, child's penis, healing, circumcision, blah, blah, blah. You'll kind of figure out all the search terms. But, you know, always, if you have a question about something that's healing, whether it's the belly button or the little red marks on them that they sometimes get from birth, you know, always call a nurse. Always. They almost always, your hospital should have a 24-hour nurse call line. So when you're looking for hospitals to give birth in, that's also a pretty serious thing to consider, because if you have a 24-hour nurse line, someone will always answer the phone. You won't have to wait for your doctor's office to open. They can decide if it's an emergency or not, if you need to take them in, especially within the first 6 months, since you'll be giving birth when it starts to get cold. Upper respiratory infections, flu stuff, anything like that is going to be really serious for a tiny person, and you don't want to hold off. You just won't. So please look into that. Even though it's Florida, it still gets colder for a tiny person. Gosh, I'm just so excited for you. Yay, hooray. Gosh, I can't tell you how excited we are, and I can't wait till we see you and host your baby shower. And oh my gosh, what else? I'm already buying stuff and setting it aside for you because I can't wait. What else? We can't wait for you to bring life into the world and be happy and crazy and awesome like we are. No. Yeah, it's funny. But yeah, we're so excited for you, and yeah, I can't wait. Okay, we love you. We'll talk to you later. Bye.